All right. Okay, hello and welcome to the second edition of Talking Teeth with Dr. J. Thank you everybody for joining me. Let me just share my screen here and then I'll get going with tonight's presentation. Okay, so tonight's topic is called cavitations, hidden infections in the jawbone. So this word cavitations gets confused sometimes with cavities. Some people, when I ask them if they know what a cavitation is, then they think it's a cavity like what you get in a tooth. And it's kind of named poorly. It's different. So cavitation is an area within the jawbone, usually that had a tooth previously extracted that never healed properly. And this image on the right is what this looks like in a cadaver, so a histological section of someone who passed away. We'll learn a little bit more about it after. And you can see it's a necrotic area where the bone is dead and not very well calcified. One second, I gotta let a couple people in here. Okay. So the bone's not very well calcified in these areas where a tooth was previously extracted. Over on the left, where my mouse is, you can see like nice healthy bone. And then in the area where the tooth was extracted, it's this degenerative bone. And so one of the findings is this necrosis that we get in there. The other thing that we find is fatty tissue. That's the most common thing. So when we go in and we clean these areas out, we often just find a lot of fat deposits. So you're going to see some of that tonight. Just a brief comment on why we see these things happen in the first place. So if I go back, this X-ray on the left, you can see these red areas outlined. These are the wisdom tooth areas. And these days, most people end up getting their wisdom teeth extracted because they just don't have enough room in their jawbone for all the wisdom teeth. And so that's why I like to share this slide here, because this showcases the work of Dr. Weston Price about 100 years ago, where he went on a search to find why are all these dental problems happening in the Western world. And so he went to observe indigenous cultures from different areas around the world. And what he found was they didn't have all of the typical problems that people in the West have these days. And so over on the left-hand side, you can see these people have very nice, wide, broad faces. Even some of them have space between their teeth. And their jawbones grew a lot more. And then as the generations went on and some of these people transitioned onto more of a Western lifestyle, Western diet with white flour, white sugar, and all these other processed foods, their jaws didn't develop as much and they had all the crooked teeth, dental decay, and all the problems that we typically see in the modern world. So this issue of cavitations that we're talking about today is downstream of this problem that we see where people's jaws don't grow enough anymore, typically. So ideally, the human jaw in development grows properly and you don't need the wisdom teeth taken out. That would be ideal. So this problem of the dental cavitations is downstream of not having enough room for the wisdom teeth. And it can also happen in other areas where a tooth has been extracted as well. So it's just the wisdom teeth are the most common areas that we find it. So when a tooth is extracted, here's a tooth, picture of a tooth inside the bone. When a tooth is extracted, we're left with a socket in the bone, in the jawbone. That socket ideally fills up with blood. It has good, healthy blood flow. That's one of the problems we sometimes see. You take a tooth out and there's no bleeding at all. So we'll talk about that a little later. And then that blood flow into the socket, it triggers a cascade of healing in order to initiate the formation of new bone into that space. And then we should be left with something like this, where the new bone looks exactly like the bone that is surrounding the tooth. Now, the reality is most of the time, this doesn't happen how we ideally want it to happen. And this is a bit of an extreme example, but it illustrates my point, where you have these areas in the jawbone, which I'm going to pop up. You'll see there's a lot of them in this patient's case. 1, 2, 3, 4. Yeah, 4 of them. So you can see with my mouse here, like this area is very nicely calcified bone. And then here where a tooth was taken out, it didn't heal properly. And you have this darker area, we call it a radiolucency. It just means that in the x-ray, the bone is not as dense. There's less calcified structure in there. And this was an interesting case because this was from another doctor at our office, and he shared this image, this x-ray, with the oral surgeon, who's the one that the oral surgeons do most of the wisdom tooth extraction surgeries. And he asked, "Hey docs, I have this new patient, 68-year-old. Can I get your opinion on the bone in the wisdom teeth areas on the bottom right, bottom left, and as well as the canine area?" And the oral surgeon, the one who does the wisdom teeth extractions, said, "It doesn't look suspicious. It's just incomplete healing that can occur sometimes. And the canine looks like a cyst, yada, yada, yada." So this is funny because he correctly recognized this is incomplete healing, which is exactly what we're talking about here, but that it's not a problem. And so my presentation tonight is going to hopefully elucidate why these areas can be a problem. And if you're someone who's looking to optimize their health, this is something you can look at in order to make some improvements, hopefully. All right, I'm going to show a video now. I just have to change the screen over. So the audio should work properly for this. Just if it doesn't, someone let me know, okay? All right.
We will now have a look at the surgical protocol for an FDOJ. First of all, what is an FDOJ? It is a fatty degenerative osteonecrosis of the jawbone. Often we find it in the wisdom tooth area when a wisdom tooth was pulled and the bone couldn't heal correctly. We also find it around root canal treated teeth, infected teeth, and also titanium implants. The problem with the FDOJ is the systemic effects that it has, the negative effects on our systemic health, that I will explain shortly in a second. Here you see an histological picture of an FDOJ. It was from a patient that had a trigeminous neuralgia all his life, suffered a lot. When he died, he asked the doctors to get a probe of this area because he thought something is there and nobody believed him. And when they had a look at it, they could see that the bone was degenerated in this area and that this was probably the cause for his trigeminous neuralgia. We have a problem with these areas. They have a constant release of inflammatory mediators, and that is RANTES. RANTES is one cytokine that is constantly 24 hours, 7 days a week high in these areas. We know that from analysis of multiplex analysis from laboratories. And what does Rantis? It is a normal cytokine that everybody has in his body. And it goes up if you have a wound, an open wound, for example. It is a chemotactical mediator, so it triggers the immune system to bring lymphocytes, granulocytes to heal this wound. Once the wound is healed, it goes down again. So it is a marker for a wound, for a chronic wound. In this case, when we have a constant release of Rantis, that means the body gets a constant information that we have a wound, and is constantly sending inflammatory markers or healing cells to this area. So the immune system is constantly triggered by this high Rantis. And we know from the medical, from many, over 10,000 medical studies, that higher Rantis levels in the blood are related to diseases like MS, arteriosclerosis, arthroid rheumatitis, also autoimmune diseases, depression, chronic fatigue syndrome, cancer, many diseases, and still the medical field does not know where this higher Rantis level come from. We know, at least in these jawbone areas, and especially for patients who have these diseases, we need to look at these jawbone areas and clean those so that we don't have these constant Rantis levels in these patients. Also, the fibroblast growth factor is elevated. So this is a constant release and causes these diseases that I just named and can promote them. Here you see a surgical protocol of an upper osteonecrosis. You see that you often have a fatty blood or yellow fatty solution that you need to clean. Often there is no good blood support in these areas. Once you've cleaned it out, the blood comes and then you have to look or have to make sure that there are no fatty eyes on this blood anymore. That's a sign that you clean it correctly. It's very important in the tuberous area to really clean everything and also remove the palatal bone, the buccal, and the distal bone so that you don't have a recurrent NICO. We also disinfect the area with ozone, and we supply the area with blood concentrates, PRF, so that we have an accelerated wound healing and a better bone regeneration. And then it's important to make a tight suture to cut out over excessive tissue or use a laser for it, whatever you prefer, and really have a tight gingiva around your last tooth so that you don't have an infiltration or penetration of bacteria around this tooth. And that helps our patient to prevent or take a part in the prevention of these diseases, or also help them when they have these diseases that therapies work better. This is the multiplex analysis of the cytokine profile, and you see that the Rantis level, would be a normal Rantis level in a normal healthy bone. This is the Rantis level they found in over 128 probes of patients. It is 35-fold higher than usually, with over 5,218 picogram. What we also see is that this is elevated. It's the interleukin-1 receptor antagonist. Interleukin-1 is an acute cytokine. That means it induces an acute inflammation with the reaction of an edema, of swelling, of pain, of heating up of the area. So this interleukin-1 is depressed, and that shows us, or that's why patients often don't feel pain. Some have a chronic trigeminous neuralgia, but most patients, it's no acute inflammation, it's a silent chronic inflammation because the acute inflammatory markers are depressed. Also, we have a very low level of interleukin 6 and 8, which are also acute inflammatory markers. And whenever a patient asks you, why don't I have pain, why don't I feel it? Yeah, the acute inflammatory markers are depressed down, and the chronic markers are high, it's kind of like a periodontitis. Patients don't feel pain, but their body, their bone resorbs, and their teeth get loose, and it's not a painful disease, and it's the same with our FDOJs.
Let's start with the enteroviruses. Now, the
Okay. Okay, so let me just switch back here. All right. So I'm just going to go over some of the main points of that video. I really like that video. That's from SDS. It's where I did a lot of my training and learned about these things before I started doing the treatment for them. So this mediator Rantes that she's talking about, it's also known as CCL5 as the inflammatory mediator. And this is what can be tested in the blood. Like she said, you can have a patient with multiple sclerosis, for example, and the studies show that they have this marker high in their blood. And, you know, conventionally, we don't know where it's coming from. And one of the areas, and one of the main areas to look for would be if they have one of these cavitation sites in the jaw. And I'm going to share a case later where I did have a patient who came with multiple sclerosis, and we treated her cavitations, and then I'll save what happened for a little after. But yeah, so these things are found elevated in the blood, FGF2 as well, fibroblast growth factor. And this same chart that she showed, this is where you can see the blue. These are the normal levels that would be expected in a normal person walking around. And then the levels of someone who has cavitations would be found elevated. So this one's the Rantes, the CCL5, and then you have these other ones that also can be found elevated here, fibroblast growth factor and the interleukin. And then you also have the ones that are depressed, and that explains why someone can have these issues and not feel pain, because the mediators that trigger pain are depressed by these chronic inflammation regions. All right. So the other thing she mentioned was that these cavitations can also occur around titanium implants and around root canal treated teeth. So this is something we also look for. So if I'm taking out an infected root canal, for example, then once the tooth is out, then with the 3D scan, the cone beam scan, and also clinically, I'm going around, maybe even breaking through areas of bone, looking for these holes basically in the jawbone where I can find some of this unhealthy tissue and clean that out as well. So it's a big part of the protocol, and it's why it's really important to, when we have any of these types of surgical treatments done, to work with a dentist that's really well trained in these areas, because you can have an infected tooth removed, and then the dentist, if they haven't been, and I was like this too, basically like 2 years ago, I didn't really know that next to a titanium implant, for example, I could find a cavitation. So I would just treat the infection that was obvious, and then I didn't know to go looking for some of these other areas. So nowadays I end up seeing patients where they had the procedure, even they maybe had a ceramic implant after an infection was cleared out, but then there was a cavitation that was there that was missed, and then the ceramic implant is a problem, and we end up needing to take them out and heal everything, clean the infection, and then try again. So yeah, very interesting. I've got another quick video for you here. So this is Dr. Dominic Nischwitz, who I also did a lot of training with.
myself. When I finally had the surgery for my cavitations on the right side, I had to laugh during the surgery because my chronic back pain just disappeared. And I was asking my surgeon, is this even possible? And yes, it was, because it never came back. Before the surgery, I was already having shaky hands and I felt like I had Parkinson's every morning, like I was drinking 3 cups of strong coffee. This nervousness also went away for good after surgery. My skin was still bad though. About 5 days after my second surgery, the left side, my skin issues started to disappear, and within the next 2 weeks I had developed the skin I was always dreaming of, and my whole back pain, which was actually referred pain from the chronic inflammation in my small intestine, which is always connected to the wisdom teeth cavitations, this was also gone.
Okay. So this was a nice little story about his experience. And this is what we find with quite a lot of patients now, where you clean out these areas in the jaw and they can even have an immediate reaction while you're working on them. And I'll share a case like that. All right. So one way we can explain these connections from the mouth to other areas of the body is through the meridian system. So this comes from electroacupuncture, and there's a study here where it defines everything, and also over here. But basically, our teeth are hooked up to the rest of our body. It's kind of like the wiring, the electrical wiring in your house. So you find different organs and systems along the same axis as certain teeth. And that's what you heard Dominic say in the video I just showed, that the small intestine is on the meridian where the wisdom teeth are. And so these areas where you have the cavitations, you can get, for example, gut issues clear up. And also one thing we often find when you clean out these areas is the patient will notice, like, maybe they have anxiety or something. I actually have a patient who I'm going to bring on one of these next times, and she suffered from anxiety every day. And she was nervous about the procedure, but then halfway through, as we're working on her, you could sense her whole body calm down, and she felt her heart, the quality of her heartbeat change. And I just saw her last week for a 3-week follow-up. So it's been 3 weeks since we did the cavitation procedure. And she said her anxiety is gone. She was afraid to mention it because in case it came back. But for 3 weeks, her anxiety's been gone, and she's noticed her heart beats a lot calmer. And she was having that every day, the anxiety. So that's because the wisdom teeth are on the heart meridian as well. So you can have impacts with the whole system, and these connections are there. I just had a little closer view here. So this is what we do for patients when they come for consults. If you have cavitations, for example, in these areas, we'll circle the tooth, and then we'll circle the area that corresponds to it. And so, for the upper right wisdom tooth, you can see it's connected to the ear. So sometimes people have ear problems. That can be actually the root of it is in one of these sites. Shoulder, elbow, hand, foot, toes. These are all spinal cord segments. So that's where you heard him talk about the back pain. More vertebra. Then the heart is here. And then duodenum, that's part of the small intestine. And pituitary, central nervous system. Okay, same thing on the other side, just the reverse. Jejunum ileum, that's also part of the small intestine. And then on the lower, we have same thing, the ear, hand, foot, toes, shoulder, elbow, and then small intestine, the heart. Okay. And then this is just a more simple diagram of the same thing. So the wisdom teeth would be the back ones here, and you can see shoulder, elbow, hands, feet, toes, heart, small intestine, inner ear, heart, small intestine. Okay. So why does this happen? So why, when a tooth is removed, does it not heal properly? And then we have this problem of cavitations, which we're talking about. So I'm really big on, like, when it comes to health, I basically think we can link every health problem to either toxicity or deficiency. So as you guys know, we're surrounded by all kinds of different toxins in today's world. And so it's not hard to imagine becoming overly burdened with toxins. And if someone's body is too toxic, then they just don't heal well. So you get a procedure done and tooth extracted, for example, the system's toxic. It's kind of like if you haven't gotten an oil change on a car, what happens to the oil? You take the dipstick and you look and it's black. And healthy oil or clean oil should be golden and it shouldn't be black. So if somebody's toxic, their system's not working as well, and just nothing happens as good as it should. And then there's deficiency as well. So we think of nutritional deficiencies, and we'll talk a little bit more about that. Both of these things, in my opinion, can contribute to poor healing, poor wound healing, and especially building bone. So in order to build new healthy bone, the body needs the right building blocks to be able to do so. And these are vitamins, minerals, proteins. So that's your micronutrients and macronutrients. So macronutrients is just protein, fat, carbohydrates. Those are the main macronutrients, the only macronutrients. And protein is the big one, right? So when we are helping a patient prepare their body for surgery, we are helping them, we want them to aim for 1 gram per pound of their ideal body weight. So if you're a little overweight, you just figure out what's my ideal body weight. So for me, my ideal is around 200 pounds, and I'm around 210 pounds right now. So then for me, 200 pounds is the amount of protein. I want 200 grams of protein per day. And that is the right amount for my body to have what it needs to heal and build. And let's say I'm trying to put on muscle or whatever it is, that's my protein goal. So if someone's ideal body weight is 140 pounds, then that's 140 grams of protein per day. So that's one of the key pillars of our bone healing protocol. And then the micronutrients are the vitamins and minerals. So that's vitamin D3, K2, vitamin C, magnesium, zinc, omega-3, and more. These are some of the main ones that we focus on. And then there's other factors. So it depends on the clinician and how good a job that they do in order to clean out the socket once the tooth has been treated, once the tooth has been extracted. If there's any sort of fibers left in there, if there's any infection left over and it's not properly cleaned out, or if good blood flow isn't established, then those areas aren't going to heal well. So basically what I'm getting at is there's the patient factors, and there's what you as the patient are doing at home before and after the surgery. 1 month before, 6 months after, that's the key window of when you want to be optimizing everything to heal properly. And then it's also on the clinician on what things are they doing to help facilitate proper healing during the procedure. So hydration, that's another important one. It's all about blood flow. I've had patients that come for surgery and they're dehydrated, and when you take out their tooth, it's dry in there and there's absolutely no bleeding. If there's no bleeding, they can't heal. Blood flow is the way our bodies heal. And so I want patients coming very well hydrated so that once that tooth is out, I want there to be nice, healthy blood flow, lots of bleeding. Bleeding equals healing. And then there's the neurological state. So if you are in a stressed out state, and especially after you have this surgery done and then you don't take the right amount of time to rest, then your body can't focus on healing. It's the same as if you ate a big meal and then you went out for a jog, and then what's going to happen? You're not going to digest properly, and you're going to have all kinds of problems, indigestion and everything. It's the same thing for a surgery. It's very taxing on the system to have one of these surgeries done. And so you want to make sure that for the very minimum 3 days after, you do absolutely nothing. You're resting, you're healing. And then even over the next 2 weeks or so, your activity level is very, very low. Maybe you can go for a little walk or something like that, light yoga or exercise or that kind of thing, but not going straight back to the gym, lifting heavy weights, running, doing these high intensity things. You're going to put your body back in a stressful state, and then your body can only deal with so many things at once, and it's not going to be able to allocate resources and attention and energy into healing properly. So that's what we like to focus on, the neurological state. Also, there's things we can do leading up to the surgery, especially 1 hour before even. And so we're starting to do like Indian head massages before the surgery to help a patient who comes in stressed out, anxious about what's going to happen. You get a relaxation treatment, and now everything's calm. You go into the surgery and your nervous system is just chill. And that's very helpful to aid in the healing process. I like to talk about minerals a little bit. So our soils aren't so good and rich in minerals anymore because of all the conventional farming methods that have been done. So if you just buy your food from the grocery stores where things are being commercially grown and on a large scale, likely most of that food isn't being grown in healthy soil. And so even though you're buying healthy things and fruits and vegetables and those kind of things, they don't have the minerals in them anymore that they used to. So spinach, for example, used to have more iron in it compared to today. You'd have to eat this many bowls of spinach to get the same amount of iron that you would have gotten from 1953. And then an apple, for example, same thing. We're just using one mineral here, iron. You would have to eat all these apples to get the same amount of iron as you would have gotten from one apple in 1950. So it's something to be aware of. And, a lot of people are getting on board with like buying locally from farmers and stuff. So I don't think it's inevitable that you have to be victim to this. I think if you source your food well by, farmers who are doing things right and are attentive to taking care of soil properly, then you can get food that has a lot more mineral content in it. So same thing with beef, for example, like grass-fed beef. If you find a good farmer who's raising grass-fed beef, that's going to be healthy soil. That food is going to have a lot more nutrients in it. So we're not doomed that just because this is one of the unfortunate facts of living today, there are ways of getting around it and improving the nutrient profile of the food. Let's talk about our patient Carol now. She's the one who I was saying we had the multiple sclerosis. So in April 2020, she had a traumatic childbirth, and her face went numb on the right side. And that's when she got a scan, MRI, and the neurologist diagnosed her with MS. They found lesions on her brain. And then that was 2020. And then 2024, it got really bad. And she had numbing from her chest to her feet and her hands. And then they found more lesions on another MRI. And all she was really offered was steroids and immune suppressants. And she was already kind of on the holistic health journey. So she refused that, didn't want it, wanted to get to the bottom of things. And so she made a lot of lifestyle changes, and she was able to get 60% better before we ended up seeing her. And she had this weird sensation where when she looked down, she felt a vibration. The other thing was this patient, she had 5 kids. And interestingly, pregnancy is actually protective against MS. And so it wasn't until she had her last kid and afterwards that these symptoms started getting worse. This video shows her 3D scan. And we're going to scroll through it and we'll be able to see some of these areas with the poorly calcified bone. So I'm scanning through and we can see in here where the bone is not as well formed. And that's where she had her wisdom teeth taken out. And we'll go through some of the other areas. So in the upper, it's really hard to see for the untrained eye, but this is all poorly formed bone in here too. And then we go over to the other side. This is more obvious. You can see where the bone is not as dense compared to the surrounding bone here. And then in the upper, the same thing. So we went ahead and did the surgery. She actually drove from Connecticut. She drove 7 hours to come and see us. And this was the plate of bone. So in order to treat these sites, you have to remove the outer layer, the outer plate of the bone, and then that's how you get into the site. So this is the outer plate of bone I removed. And then you can see here all of the fat that's deposited in there. And this was just crazy. When we opened hers, her sites were just gushing out with fat. And you shouldn't have fat in your jawbone. Other bones, like your bigger bones in your body, like your femur, where there's marrow space inside, then that's fat in the bone marrow. Maybe you've eaten bone marrow before and you can attest to that. But in the jawbone, there's no marrow spaces. It's just supposed to be cancellous bone on the inside. So you see these like little spicules of bone. That's how it should look, but it shouldn't be filled with fat. Okay. This isn't the same patient, but this just shows partially how we clean out the sites. And this is using the piezo surgery. It's an ultrasonic device, and it vibrates at a very high frequency. It uses sound in order to vibrate the bone, and it's a very good tool for cleaning tissue and improving and promoting blood flow. So that's once we go into the sites and clean them out, then we really thoroughly clean with this device. And that's how we clean out all the fat cells and just ensure that we have good, clean blood. You saw in that video earlier that I showed that you see these fat droplets coming out. So we're going to keep cleaning until we no longer see any more of those fat droplets. Okay, and then you also saw in the video that we treat the sites with ozone gas. So once it's been cleaned out, we use ozone gas to infiltrate and disinfect everything and oxygenate. It also helps improve blood flow more. And then we do the PRF, which stands for platelet-rich fibrin. At the beginning of the procedure, we draw some blood from your arm, and then we spin it in a centrifuge, and then it makes these membranes, which are like gels that are formed 100% from your own blood. And it's really cool because we're concentrating the stem cells and the growth factors from your blood and then making them into these gels that we can insert back into the site. So it's supercharging the healing, and it's like a wound dressing made entirely from your own body, which is really very cool. Okay, I have this page on my website, so terraindental.ca. And if you click on what we do, there's a section called biological tooth extraction. So whether or not we're taking out a tooth or cleaning out a cavitation site, the procedure and the process is the same. So we do nutritional consultation, help you optimize all the nutrition. And that's what we call our bone healing protocol. So that's for 1 month leading up to surgery, ideally, or minimum 2 weeks before, and then 4 to 6 months afterwards. That's how long it takes for your body to be regenerating new bone. And then the day of surgery, we employ various practices to help you be as relaxed and calm as possible, like we talked about before. Activation of the parasympathetic nervous system. And then careful removal of the tooth or careful cleaning of the cavitation using some of these tools we talked about, such as piezo surgery. And then we do thorough disinfection. I can't mention ozone on the website because some of these things aren't approved in Canada. Same thing with this whole topic, cavitations in general is frowned upon, and it's not recognized as a real problem, mental profession. And so it's one of these things we're dealing with that just the industry has to catch up and change. It's like what I showed you before with the oral surgeon who didn't acknowledge that this was a potential disease problem that could affect the health of the patient. I just heard, I don't know if somebody logged on. Let me just quickly check. No. Okay. I'm almost done, and then we'll open it up for questions. So then blood concentrates, that's the PRF, and then various use of different strategies to limit pain, swelling, bruising. So one of the things we do is we have this healing mask, this cooling mask that we put on patient's face, and it cycles cold water through it, and then that really helps reduce the pain and swelling. So this is what I call the biological tooth extraction, or the biological protocol for treating a cavitation. So, you're looking for someone to do something like this for you, you really want to make sure they're doing most of these things, and that's how you know that you're going to heal properly. Just having a tooth out and having it stitched up or something, unfortunately in today's day, just doesn't heal properly most of the time. Okay, so with Carol, while we were working on her, I'll just read this and then I'll talk about it a little more. So she said, I heard stories of people having certain experiences during the procedure, but I honestly didn't believe that I would. At one point during the surgery, my right hand and arm up to my elbow suddenly went completely numb. Okay, so she was having partial numbness from December, and I saw her in March. So she had all this partial numbness in her hands, both sides. So while I'm working on her and cleaning out the cavitation, her hand on each side went completely numb. And then after about 30 minutes, they went completely normal, and she was able to feel both hands normally for the first time since December. And then within 4 weeks, she experienced 100% improvement in her hands. So this happened instantly. While we're working on her, she's having this crazy sensation in her hands while we're treating the cavitation. She also, at the end of the surgery, had this like massive emotional release after everything she'd been through. And yeah, it was quite an amazing experience to be part of and be able to help her with this. And all I did was clean out those areas of her teeth. But so this just sums things up. December was at her lowest point, and she would give herself the worst rating for all possible symptoms. Sorry, 1 second. Okay. And then March, she was 60% better through lifestyle, right? And that vibration that she felt was 40% out of 100. And then April, which is a month after the surgery, her hands were 95. She said they're actually like 100, but she said, there's like a little tingle or something. And then the vibration was 85 to 90% out of 100. And so I constantly follow up with her every month or so, and she's still doing great. And, she's basically experienced almost a complete resolution of her MS, which is one of these things that doctors tell you you're going to live with your whole life. So just amazing example of like some of the responses that patients can experience by getting these things cleaned out. Just some additional resources here. So the IAOMT, International Academy of Oral Medicine and Toxicology, they're the ones that put out the SMART protocol for the safe amalgam mercury removal. They just came out last year with a position paper on the cavitation, so that can be found on their website. I can share these links as well with whoever wants them. And Johann Lechner, he's the one who did most of the research on these things. And so he has a whole textbook on it. And I've got an online lecture of his as well that I'd be happy to share. Okay, we'll just quickly talk about the future plans for the group. And what we can do, actually, I gotta build an email list of people who just want to be part of this. And so send an email to treatment@traindental.ca if you want to be on the list. So then just say, hey, I want to be part of the Talking Teeth with Dr. J, and then we'll save your email and then send you updates. My Telegram group, if you're not on it, you'll want to join it. There's a lot of resources on there. And then after today, we're going to make this monthly Q&A a membership. So $40 USD per year for 1 year membership. If you've already had surgery treatment with me in the last few years, then you're going to get 1 year free. This is the website we're currently working on, and we've recently bought the domain Talkin'Teeth, talkin-teeth.com. So that's going to go to the course and the website. And it's not ready yet, but eventually that's where you'll find everything. So if you want, you can put your email in the chat. Where else? Put your email in the chat of this meeting. And then if you want to get updates and emails about this, okay? There's the Telegram group. I've got all kinds of resources. And that's it. Thank you. Here's all our links. There's our clinic, terraindental.ca. You can email info@terraindental.ca, or the other one I showed you, treatment@terraindental.ca. Canada Biohealth, this is the health lounge that we're putting together and building downstairs. We just got our hyperbaric oxygen chamber, which is very exciting. So patients having surgery will have access to that, as well as IV vitamin infusions and a bunch of other treatments as well. And then, you know, I'm on Instagram and, you know, all these places. But yeah, okay, let's open it up to Q&A. Thanks for your attention. I'll just stop sharing. Okay. So looks like Shane, you have a question?
I did, just a quick one. While you were going through the extraction, I was wondering, you mentioned the patients would, of course, have nutritional support beforehand, but what's the timeline between an extraction and the implant? Because sometimes it can be same day, but sometimes you have to wait.
Yeah. Yeah. Basically, 90% of the time, you can, if you're getting an implant to replace a tooth you're having extracted, 90% of the time it can be done the same day. So you take the tooth out, clean everything up, then you, as long as you have enough bone to work with remaining, then you can make a little hole in the bone, and then you can screw an implant into there.
Okay.
And so the times where you're not able to is if there's just too much infection and there's no good bone to work with, and you need to wait for bone regeneration in order to actually have a foundation, a solid foundation to work with.
That's what confused me, because I think you had mentioned that if a tooth is extracted, a process of bone loss can actually begin.
Yes.
When it happens because there's no pressure from.
Totally.
Yeah.
So one thing just to clarify, like we almost never replace wisdom teeth, because the reason someone had the wisdom teeth extracted is because they didn't have room for them in their jaw. So
there's really no point.
No, you don't need them. You can function totally fine without them. So it's the other areas we'd be talking about where if it's like a first molar or any other tooth, where if you're losing a tooth, then it becomes the desirable thing to replace it. And yeah, you do start losing bone if you have a tooth extracted and nothing is placed there. What we do, if it's one of the situations where we can't put an implant in right away, then we do a bone graft. So we'll take bone material. We can either take it from somewhere else in your mouth and harvest the bone material, or we can use an exogenous material like a mineral blend. And you put that back into the socket mixed with your blood, the PRF that we showed before, and then you put that in, and that maintains the space and prevents it from collapsing.
So you get the space and you maintain the bone.
Yes.
Yeah. Okay.
Maintain it with the bone graft, and then it buys you time. If you went 5 years without putting anything back in there, eventually that would resorb as well, because there's no stimulation happening on the bone. But within 4 to 6 months, even up to a year, you shouldn't get much resorption. It should still maintain it, and then you can have an implant put. But definitely, if it's possible, the best time and the best way to do it is by putting the implant the same day that you took the tooth out.
Okay.
That's
Thank
how
you.
you lose the least amount. So my tooth, like I had a root canal, I had it extracted, and I had the implant the same day, and I've had basically no bone loss around it.
So that's ideal, but when it's not, there's ways to compensate
Yeah,
for it.
exactly.
Okay, that's good to know.
Yeah, like I can share a little photo quickly here.
You can share my photo, but you might
No,
shock
no,
the other
yeah.
the other participants.
No, it's nobody. It's gonna be anonymous. Um, 1 second. Okay, so this shows a patient who has a lot of gum disease. So in the back areas, you can see the front teeth. These teeth are all in healthy bone. There's an infection here, but the rest of the teeth are in good bone. But the molars, there's no bone. So see how you can see right through the tooth there? There's black in between the roots and all here too. So this is all infected bone. And down here, you can see this is all infected. So I can't put implants in here. I have to take out these teeth, clean, like with the ultrasonic, like I showed you, get healthy bleeding. Then I have to do a bone graft, build the bone back up, close everything up, and just let it heal for 6 months. And then I'm going to do the same in this area. I'm going to do the same in this area. Then we'll take a new scan and see how well the bone healed, and then plan implants. So I've illustrated once the bone is healed here, that's what it'll look like, and then we can plan the implants after. But I can't put in anything. See how there's no bone, Shane?
I do, and that's like a lot of growth that needs
Yeah,
to.
this is how destructive the gum disease can be. So
And
these molars, they're all loose. They're not being held in the bone anymore. If I push on them, they all wiggle. And same with all these teeth. These teeth are all bad too. The bone has been.
is from the underlying infection, or is it malnutrition? Is it malabsorption? Is it poor diet? Is it all of the above? Like, what's going
Yeah,
on?
like I mean, the old way of thinking is it's bacteria. It's not. It's like a hygiene issue, and bacteria get it in there, and people don't get their teeth cleaned, or they don't keep them clean, and then it progresses. I think that's BS, because there's healthy people who never go to a dentist, and then after 20 years they go see a dentist and their teeth are perfect. And so there's something else going on. It's not because you didn't go for a cleaning.
That is precisely my brother, who has never had a cavity in his entire life and has a horrible diet.
Yeah.
Our dentist, when we were younger, he just got perfect saliva or something.
Yeah, it's a so in a natural state of health, it's like that slide I showed with Weston Price of the people who live more, conventional or what's the word? Just natural lives, like nomadic hunter-gatherer tribes, and even more agricultural people that aren't on all the processed foods and stuff. Their bodies are healthy, they're resilient, they're spending time outside. They're not in this zoo like we, in our modern world, we're all basically like zoo animals.
I think they're treated better than we are.
Yeah.
Actually.
Well, they have more risk in their life. Like they could break their ankle and they're screwed, or they could get eaten by a tiger or something. But we're a lot more protected in our modern world. But yeah, other than that, they probably have way healthier lives.
There's a fun fact. Dr. Price was actually the world's first anthropologist.
I don't know if he's the first biological dentist.
No, but his work is foundational to anthropology, sociocultural anthropology. It was the study of peoples in context in their surroundings. Now, he had a very strong focus on dental and oral hygiene, but he also had an interest in bone formation and the
For sure.
introductions of
But
process.
you think there were no anthropologists before? Like he was only in the early 1900s. You don't think there was the field of anthropology before that?
Anthropology before him wasn't exacting. It was very qualitative. It was very observational. It was not quantitative. He was one of the first that did exacting and precise measurements and tracked over time and over generations introductions of processed foods, wheats, sugars. And he said, look, you introduce sugar, you now have two problems. Jaws is smaller, faces are smaller, teeth are crowded. Now we need braces and all of these other things that come
Yeah.
with it.
Yeah. So the thing that he, like the one piece now that's been added that he was missing is actually just, and I'll probably do a meeting on this whole topic of jaw development in sometime in the future. And we're going, me and my brother and the other dentist that works with us, Dr. Polovic, we're going in a few weeks to a conference all about this on jaw development. And particularly like, how do you help kids who are still in the growth phase? How do you help them grow so they don't need wisdom teeth extracted, so they don't need braces? And
Is that like the palate expansion
yeah,
process?
yeah, but what how does it happen naturally? So that's what Weston Price was missing, was it's a lot of it is just the density of the food. Like how hard was it to chew the food?
Precisely this, because even our musculature, as we are
Exactly.
sedentary and not challenged, we decline.
Yeah,
Our body is designed to resist and to be challenged.
yes.
Living in the lap of luxury turns you into jello.
Well, it's convenient. What's Comfort Crisis, right? There's a book called Comfort Crisis. Like,
I haven't read it, but it sounds
yeah, every technological advancement that basically makes life more convenient contributes to the devolution of the species.
and society
And what?
and society as a whole.
Yeah, exactly.
Because now things have to be easy. Children are not challenged in school because that's not fair. They won't feel good if they're not given an award, but they're not mastering basic skills. People are taking a car instead of walking a kilometer. Well, then that'll lead to
Think of this. So before you had refrigeration, in order to preserve meat, you had to smoke it, right? So it was like jerky. And that's a lot of what people would be eating, is these dried out smoked meat. And if you ever,
the jaw, it's hard to
it's
eat.
crazy hard, right? Like your muscles of your face are exhausted.
It's sore. And
Yeah.
if you eat a pack of jerky now, or it's that, or we'll just have
Most of the jerky is too soft now. You have the jerky now and it's like all this tender, but it would be more like shoe leather.
Yes.
And yeah, you would get a jaw workout from eating. And now if you think about it, most of the things we eat, like start paying attention to the food you eat day to day.
You don't
Most
have
of it's pretty soft. You don't have to chew much, right?
I mean, white bread or a slice of pizza, there's no challenge to your jaw.
Well, if you get like if you get fresh bread and if you make bread or something, it kind of goes stale after a few days. If you chew on that gives you the same effect in the jaw, of where your jaw gets really tired.
Well,
right?
now we have this entire group of young men that are doing something called mewing.
Yeah.
So they're buying like rubber balls,
Yeah,
and positioning their tongue and just chewing to fully develop their jaws, because their whole faces have collapsed.
yeah.
And they're not reaching their genetic potential. And
Yeah.
that's not mechanical. It's not nutrition based.
Exactly. And that's the one part of it Weston Price was missing. Like it's the actual, just the physical quality of the food.
And the movement of the body in a challenging environment. One of my instructors at U of T as an anthropologist, he says every time he goes down to South America, he loses about 45 pounds. But his step count isn't much higher. But he said there is no such thing as a flat paved road. You are walking in a jungle up and down. The amount of energy it takes to walk half a kilometer or a kilometer, he said, is enormous.
Right.
And it is a huge effort to go get some water. Even though you can see it, it's not level terrain. The ankles have to be much stronger. You need to be more flexible. And that's just a daily challenge.
Yeah, definitely.
Yeah.
Does anyone else have a question? I mean, we can just keep talking. Yeah, Susan? Susan, you can unmute yourself. Or maybe you're not even on mute.
I have a quick question.
Yeah.
Hi, you were just speaking of forming bone. Can you speak to forming gum, like a gum that has been deteriorated? I had an infection and you can see part of the gum is like kind of deteriorated away and that tooth is super loose.
Yeah. Well, it's basically the same thing. So, but the gum's not going to get better until the infection's treated.
So, someone mentioned they scrape from like the roof of your mouth or something horrific.
Yeah, so no, they're talking about a gum graft. So there's cases where there's only gum damage, but the tooth underneath is not infected. And so it's called gum recession. So it's when like you would see a tooth and then the gum has dropped and you can see part of the root of the tooth. And in order to treat that, you can take gum tissue from the roof of your mouth and then stitch it in place. It's called a graft, and you stitch it in place over top of the area that's receded. But what you said with how you have an infection and then the gum is getting infected because of it, you can't just have a gum graft procedure because underneath it there's an infection, and that's why you have the problem. So you need the infection treated, and then the gum can resolve as everything heals.
Okay. If that tooth were to be extracted, the tooth that had it's a baby tooth. There's no tooth under it.
Yeah.
So it had a cavity. Whatever he did when he filled the cavity, it became infected a week later. Then he told me I needed a root canal, and I said, "Go away." And I healed it on my own, using natural effects. And I'm just curious, if I just decide to go in and get this tooth pulled, and put a ceramic implant in.
Yeah.
There is no gum, but that might be the problem. I mean, would you just have to graft it, or would you just let it grow naturally around the new fresh tooth?
So how old are you?
50.
Okay, and so you've had this baby tooth like
My whole life.
just started being a problem. So
I have 2 of them actually.
okay, yeah, that's common. I mean, a lot of the time there's bone under it, even though there's no tooth underneath it. The baby tooth is kind of really short, like there's no root left anymore. And you can take it out, clean out any infection, and a lot of the times you can put a ceramic implant in right away.
That's great. And what if
Yeah.
that gum line is receded? Will the ceramic implant stay? Okay.
Yeah, like you can build up the gum, you can build it back up usually at the same time during the procedure.
Would
Like
that be
maybe I can find a picture. I might be able to find a picture of a situation like that. So you're the one who just asked a question. You're GI, that's what you're labeled as?
Yeah, it's just G.
Oh, G. Okay, sorry. And then Susan's hand is raised, but I don't know if she can hear me. She just wrote in the chat. You can try to talk, Susan. Or if I can't hear you, so write your question in the chat and then I'll answer. Okay, where is this?
Okay, I have another question while you're looking then.
Yeah.
Why would anyone who was filling a cavity, or any dentist, I should say, why would they literally make an incision, like cut a part of the tooth off?
So an incision would be in the gum, and then the tooth, you can't make an incision in a tooth. You can like drill a piece of a tooth away. Does that, I'm not really sure what you mean. Like, was it the gum was cut or was the tooth drilled away?
I almost wanted to stick my mouth in front of the camera and show you. So the same dentist who was a nightmare that filled the baby tooth said I needed to come fill the other baby tooth. And that, whatever he did, popped out of my mouth a few months ago. And the tooth that he worked on, it has a literal cut, like a jagged cut in it. And like there's kind of like a semi-hole that food gets stuck in that I have to pick out, like and the whole side of the food has like a V cut. The whole side of the tooth is like a V cut. It's very strange. And the gum almost seems like it has like a little cavity hole inside the gum. Like a, yeah. Like, so I can probably put my mouth up to the camera.
I don't know. Like, I mean, here, one sec. Let's do one at a time, okay? Let me just share this quick. Okay, can you see my screen?
Yes, we can see it.
Okay, so this is a similar type of situation. This tooth had an infection, and then the gum is all receded. So the gum should be up higher. See how the gum on this tooth is here, and then on this one, it's dipped down. Okay, so this tooth we took out. Sorry, there we go. Let's see here. Okay, tooth's out. You can see the huge bone defect from the infection. So this is where the bone should be, and it's dropped way down. That's where she had the recession on the tooth. Sorry for the graphic photos. Then we placed the implant, and then we grafted the bone. We built the bone all the way back up. So that's the bone material I was talking about before. And then covered it all in PRF. So this is the gels that I was talking about from the blood. And then we stitched everything together. And then we were able to get complete regeneration of the gum tissue that was lost. Sorry, let me just find the last one. There. This is the day of surgery. So I left the defect there, but it's all filled underneath with PRF. That's going to become new bone, new gum tissue. So as she heals, this is all going, her body's going to convert it all into new gums, and then this is going to be all nice, healthy gum. And I've got a follow up. This one should be.
Good job.
You know what? I don't know if I have the fine. Yeah, so you can see it started. This is just 2 weeks later. Rotate right. Just 2 weeks later, you can see all this starting to regenerate.
That's amazing.
And it would have gotten better and better after, like, that's just 2 weeks, right? But
That's amazing.
I just don't have an updated. I might. I don't know. Let's see.
I could.
Okay, so you want to show me this thing?
Yeah. All right. Let me take the camera. Can I just ask you how much did it cost to rebuild that tooth?
Usually it's like 6,000 for an extraction and ceramic implant.
Wow. Okay.
Total, including the final tooth. It's like everything.
Really weird. I get I'm doing this. Are you gonna put this on the web?
I don't know if I'm gonna be able to see. It doesn't look that clear, but
Okay. This is the one that's cut. Let me put a light in there. Hold on. Here's my phone. This is so funny. I can't believe I'm doing this. You're the best, Dr. J. You know that. Okay. Ready?
Which one? That's the baby tooth?
Yeah, and cut in the.
It just has a chunk missing out of it.
Yeah.
Yeah.
Okay, and this is the one that's the other
It
one you
just
were
like looks like the filling fell out.
Yeah, like I don't even know. It's like the whole thing popped out.
But I mean, it's been in your mouth for 40 years too long. You're out of the camera.
Oh.
You're too. Yeah, it's basically exactly like the one I just showed.
Yeah, it looks very similar.
Yeah.
And that one's been loose for many
Yeah.
years. Hi.
How did you find me?
Beth.
Oh, are you the one? You're the one messaging on Telegram. Yeah.
Yeah, that was
You're
me.
in
Hi.
Florida?
I'm in Florida.
Okay. Well, I mean, the prices I just told you, that's in Canadian dollars, so that's basically like $500 US.
Well, yeah,
it's
right.
It's like 1.4, so it's probably like under 5,000 US, which I know the dentists who are doing this in the States charge around 10,000 US.
Wow.
So
I do have a friend who lives in Buffalo, New York, and he always talks about going across the border, which
yeah,
is Niagara Falls.
yeah,
and
exactly.
It's not very far. You said 2 hours from you, right?
Yeah, I go to Buffalo all the time to pick up stuff.
Oh, you never know. I just might be
Yeah.
coming to your office
Yeah.
soon.
Well,
So
I'd love to
5,000
see you.
for that. So if I had to pull this tooth and rebuild the gum, saying just generally, and then the other one is just a cap or a cap. I could just simply just fix that one, right?
Well, I mean, it depends how it looks underneath. It looks pretty broken down. That one might be on its last leg too.
So just pull them both.
Probably. You don't have to do them at the same time if you rather like spread it out, but because
You do-
you got to think about it. If you get a cap, like you might spend like $2,000 on a cap, and you don't know how long it's going to last because the tooth is so beyond its years,
Yeah.
right? So you probably want to just do what you know is going to work.
So
How did you find me?
God.
Oh,
Beth
oh,
Martin.
you're one of Beth's. Okay, nice.
Yeah.
So are you
So-
onto the whole Garrett Smith stuff?
No, I'm not.
Okay, that's been like
No.
my latest thing that I'm really diving into.
Yeah, I'm on the more of the chlorine dioxide kick and the MMS, which I think has saved me from having serious problems. But
Nice.
yeah, 100%. So yeah, it's time I do this. I have a dentist, a guy I know. I went to the IAOMT convention in Sarasota 2 years ago.
Yeah.
3 years ago. And I was working for a company, sauna company. And so I met a dentist and he's great. He's in Orlando and I trust him enough to do this because, you know, he's awake and aware. He works with like, he does like muscle testing and works
He does ceramic implants?
Yeah. Yeah. But
Yeah, so that list on my website, the one I showed, that's basically what you can use as a resource to say, okay, do you, like, it's all on there. Do you use PRF? Do you use ozone? Like those are the kind of things you want to ask. And the other one is this specific type of ceramic implant is important too. So for me, the only type of ceramic implant that I would really want in my own mouth is the SDS, Swiss Dental Solutions. So you want to see if that's what they're using.
Okay. As a matter of fact, I called another dentist that he recommended closer to me here in Florida. And I asked today and they said they don't normally, they only do titanium.
Yeah.
They don't normally do ceramic, quote unquote.
Then don't go to them.
Yeah. So I was going to, yeah. So anyway, so he will do ceramic. And I'm wondering, are you really that much cheaper being in Canada? Than
Well,
like
look up right now. Let me look up for you how much. So
it would totally be worth the trip then, because I have no insurance.
Yeah, it would pay for your trip as well. Like, so let's look.
Yeah.
6,000 Canadian to USD. Yeah, 6,000 Canadian is 4,300 USD. So get a quote for the full amount of the extraction, the implant, and the final crown, and the 3D scan, all of that. And you know, it might be like on the low end, it might be around 6,000, 7,000 US.
For both.
But I know people who are doing it for 10 or 11, like 13. I know a guy does it for 13,000 US. It's crazy.
So you're saying like, it'd be like, if let's pretend I just came to you next week, it would be like $5,000 approximately for both teeth or just one?
No, each.
Oh man.
But it's not all at once because you don't get the tooth right away. So we take the tooth out, put the implant, and then you come back 4 months later, and then we connect the teeth onto it.
Interesting.
Yeah.
Okay, so it takes 4 months. So it's almost impossible to do a tooth in a day.
Well, no, I do tooth in a day all the time, but it just depends on the teeth because your tooth is a back tooth. So it's like one of the molars, one of the chewing ones. And so it's kind of risky if you put a new tooth on it right away and you accidentally chew on it, you'll screw it up. And so we typically don't put teeth on them right away when it's a molar, when it's a back tooth. If it's your front tooth, we put the tooth in the same day. And then you just have to know for 4 months, you can't bite into anything on the front.
Oh, interesting.
Yeah.
Yeah, they're both right here, right too.
Yeah, so you wouldn't want to attach the teeth right away.
Okay.
Yeah.
So SDS ceramic.
Yeah.
Hey, thank you so much.
Yeah, my pleasure. Thanks.
I
for
have you
coming.
on Telegram if I want to come
Yeah,
see
totally.
you. I'll let you know. Thank you so
Okay,
much.
nice to meet you.
Nice to meet you.
Okay.
I'm going away. Bye-bye.
Okay. Okay, Susan. So can you tell from a 3D scan 100% accurate if there are any cavitations or infections? Yes. It's the best tool we have. Most of the time it's super obvious, and there's some cases where it's 99%, and sometimes it's not so definitive, but we base it on the health issues. So if you're having health issues and it looks like more likely there's something there than not, then it usually makes a good case for going in and cleaning it out. And you know, like the bottom ones are usually what show really obviously and definitively. And if you had all your wisdom teeth out at the same time, we can assume that if you didn't heal properly from the bottom ones, then you probably didn't heal properly from the top ones either. Okay, hope that answers that question. When you remove a large molar, i.e. 46, which is the bottom right, very large tooth, there would be no bone where the 4-6 roots were. Do you use bone minerals mixed with my blood in order to make new bone? How is it immediately ready to put the ceramic implant in when you just placed it in the bone material minerals? Okay, so I showed it in those pictures before. So why don't I show it again? Can someone just tell me if you can see this X-ray? No, you can't. Okay, now? Yeah. All right. So the roots of the tooth were here and around, well, around here. So I took the tooth out, cleaned out the infection, then I made a hole in the middle, so in between the two roots, placed the implant, and then I filled the space, the void. So you're right, there are voids. I filled it with the bone grafting mineral material. So it would have been one called TCP, tricalcium phosphate. And filled that all in, and then over the next 4 months, her body is going to convert that and turn it over and make new bone. All right. And then it heals, and then this now is healed, and it's all her own bone, and it's healed in those spaces that you were talking about. And then after 4 months, we'll make a tooth to go on top of here. I can probably... I can show more. I mean, if you guys like this, I can show more of this type of stuff. Does anyone else have a question in the meantime?
I did.
Yeah.
So I had a question about placement. So sometimes you would use one complete implant, but sometimes it's two parts.
Yeah.
Can you explain that to me?
Yeah. It's basically that same conversation about if we're putting a tooth on it the same day or not. So if it's a front tooth where we're gonna put the implant in and then put a tooth on it right away, then we use the one piece.
Okay, so there's options then. So maybe
Yeah, and then if it's a molar, if it's a
bones
back tooth,
regenerates, it would be a different approach, or we could put the
yeah, like if it's one of those molars that we're not attaching a tooth to right away, then you don't use the one piece, you use the two piece because the two piece stays lower down on the gums and there's less chance of you biting into it. And then when it comes time to restore it, then you cement a little post into it and you make it taller and then you prep it. So I can show that.
Okay, so it can be multiple steps.
Yes.
If you need time to heal.
It's after the 4 months. If you're putting the implant in, but not putting a tooth on it right away, you wait 4 months. And then, here, did I figure? Oh, I got it. Okay. You wait 4 months and then you do the next step where you cement the post and prepare the tooth. So that's what I'll show you right now.
That's good because for someone like me, a little more time to heal.
Yeah, for sure. Okay. Okay, so this is one of these two-piece implants that's healed and it's been 4 months. So you can see the gums have all healed really nicely around it and it's just above the gum level. So it's below the level of her teeth, very unlikely for her to bite into it by accident.
Okay.
And then she's got an amalgam filling here that we're going to replace during this same appointment. So there's the post. So the post, I've cemented it in.
Mm-hmm.
And then we
I
remove.
kind of like this because say a decade or two down the road, you can replace the post if it's wearing because it's solidly entrenched in the bone. A little bit of an option because if it's a single piece, you got to take the whole piece out.
No, it's not quite like that. Like this won't wear. So I've cemented the post and then I've prepped the rest of the implant down to the gum level.
Mhm.
Then we're going to make a tooth that goes on over top. And then there's the final crown that's cemented over top. So there's the level where it joins up with the implant down at the gum. And so this can be replaced. So I can cut this off and I can put a new crown on it if it ever needed. I did that today. Does that make sense? This won't wear out. What can sometimes happen is this post can break and then we have to put a new post in it. The one piece ones, they don't really break because it's not a weak point where you if this breaks, I don't have to put a new implant. The implant's still fine. I just put another one of these posts in it. One of these.
It's far less complex then. It's just
no, it's fine. It's not a surgery. Like this part is still in there and it's fine.
I like that. It's not really an option with the titanium ones.
Yeah, and the really cool thing is you can see how healthy the tissue is around these implants.
It's beautiful and pink.
Yeah, there's no inflammation.
Thank you.
Yeah, no problem. So there was another question I think I saw. Do you still see my screen or no?
I see you, and I see a question.
You saw my screen. You saw my screen when I was showing those pictures, right?
I did, yeah.
Yeah, okay. I don't know why it stopped. Maybe I don't know. Okay, first question, Paul. I never had any wisdom teeth come in the lower jaw. The 2 wisdom teeth came in the upper only and kept growing. So my regular dentist suggested that I have them removed, and I did. Okay, so now that's the one other situation where you could have a cavitation where you never developed a tooth. So we all should have 4 wisdom teeth develop. And even actually 10,000 years ago in the human story, we even had an extra set of wisdom teeth. So we had a second set of wisdom teeth. And as our jaws have gotten smaller, you get some people who don't develop these teeth. And where the tooth was supposed to develop, it can end up being a hole or a cavitation in that spot. So there's some people who have health issues that we find, oh, you never grew wisdom teeth, and there's actually a cavitation in the spot where you never grew a tooth. And so that's something we can see as well. And then you go in and you clean it out, and it's the same thing. A cavitation formed where the tooth never formed. Okay, so yeah, Susan, you could have, even though you only had the upper wisdom teeth out, you could still have cavitations in all 4 areas. Once you get your ceramic implant, is it better to wait longer than 4 months, or do you get max bone healing right after 4 months? Yeah, so everyone's healing time is a little bit different. I've seen somebody completely regenerate bone, hard, dense bone, in 2 months. It was pretty crazy. And there's others where it takes longer. It can take 6 months. So I generally base it off of the health of the patient. So if I have someone who I know is robust and I don't worry that they're not going to heal, then 4 months is the standard. So you just wait 4 months. The bone is super solid after 4 months. And then if someone's a little bit more health compromised and I'm a little bit more worried about how well they're going to heal, then I'll wait 6 months. So that's usually the window. So 6 months on someone I'm worried about that they're not going to heal enough in 4, and 4 months for healthy people that I'm not really worried about. That was it, right? Yeah. We also test it. So when you come back after 4 months and we're getting ready to start the process to put the tooth on it, we have ways of testing. So I have this device that taps the implant and it gives me a reading out of 100 of how solid it is. And so before we do it, we test it and we make sure, yeah, it's solid. You can also do a rotation test, and you can attach a device, the torque wrench, into the implant, turn it, and if it doesn't turn at the given level of pressure, then you know it's solid in there. If it turns, then you know you might have to wait longer. Okay, you're welcome. Hope next time we get your microphone sorted out and we can chat face to face. All right. Is there anyone else?
I just have a quick question. If you don't wait, like do they ever just put it in immediately? Like if you know what I mean? If the one tooth that's not the gum and the bone is perfectly fine and they just pulled the tooth, could they put it in then immediately, or you should still probably wait?
No, that's what I'm, so, okay. Let me show you. I made a post on Instagram about this. Let me just sign on to that. So 90% of the time, you can put an implant in the same time that you take the tooth out. But the implant is 2 parts, right? There's the part that goes into the bone, and then there's the tooth part that goes on and replaces the actual tooth. So it gets a little bit confusing because sometimes when we use the one piece, like in the front teeth, where we're able to attach a tooth right away, you do everything in one day. But if it's a back tooth and we're using the 2-piece, we're not attaching a tooth the same day, but we're able to still place the implant the same time right after the tooth is removed. Does that make sense? I know it's like a little bit confusing.
Yes, and you basically don't put the second part, the tooth, because you don't want the chewing to screw up the bone.
Yeah, but you still only had one surgery. So you had the tooth taken out and you had the bottom part, the screw of the implant put in the bone. And then you just don't attach a tooth to it right away. You let everything heal around it. And then after 4 months, you put a tooth on. Let me share my screen again. So this was this public service announcement that I made. You guys can see it?
Yes.
Okay.
I've
So
enlarged it.
this is something, because oftentimes I'll have a patient come to me and they already had the tooth extracted and they waited for it to heal. And then they come to me and they say, I want an implant. So I look at it and I go, it's too bad that you didn't just come to me when you needed the tooth extracted, because I could have just done it all at the same time and you didn't need to have a second surgery. And then sometimes the bone shrinks and then you don't have as much bone to work with, and then it can complicate things a lot if they didn't do the bone graft, right? So the best case scenario is you take the tooth out. So this is one of these situations. So this tooth here was infected. It was an infected root canal. You can see all the inflammation around the gums. Like these gums are more healthy. And then this one's all puffy, right? So that tooth's going, it's not healthy. And there's the root canal that we took out. And I was able to take out the tooth and then put this implant in the same day. And then I shaved the implant, shaped it to be a tooth, like, the under part of a tooth. And then she got the final crown. This is after everything healed, and so is this. But she left on this day when we took out the tooth, she left with a tooth. She never went without a tooth. So it was done in the same appointment where the tooth was extracted, implant was put in, and a temporary tooth was made. And now sometimes I actually put the final ceramic tooth on the same day if possible. So this post is really good here. So try to find that one if you go on my Instagram. So if you're going to lose a tooth, the best time to get an implant is during the same appointment as the tooth removal. You can see here, she didn't lose any bone. So the bone is all the same here and here. When a tooth is extracted and nothing is put back, you get this big bone defect when nothing is put in its place. So yeah, I don't need to read this all right now, but this is something people don't know, that, and a lot of dentists don't even believe in this being possible. So they'll just take a tooth out and then they'll send the patient later to go get an implant. And the best time to do it, if possible, and like I said, it's doable 9 times out of 10, is to have the implant put in the same day that the tooth is taken out.
That's actually exactly why I'm your patient. Because if you recall, I had the accident to my mouth. The oral surgeon pulls a front tooth, and he said, come back in a couple months.
Right.
I want to remove all the other teeth. And I'm like, you're not touching them.
Yeah.
You're not my dentist. Leave them alone. I am going. So I walked out with gauze and I'm like, I can't believe this just happened. And I don't know where to go because my dentist, Dr. Schwartz, the biological dentist, passed away. And it's not hard. It's hard to find another person who understands. And if I didn't object, I would be missing 6 of whatever is left and no bone.
Yeah, exactly.
These are critical times, and as patients and people, we're not educated to this.
Yeah, I mean, that's the hope is like, that's what's really happening through podcasts and that kind of stuff, is actually you get one of these dentists, like Dr. Dominic, who I did my training with. He's been on probably like dozens and more, maybe even almost 100 different podcasts now. And so people who are health conscious and listening to these different health podcasts are getting educated, and then are learning about these things, and then are going to their dentist and asking about ceramic implants, asking about cavitations, asking to have metals removed. And the dentists are going, Oh
They
no,
don't like being challenged that.
no, but they're gonna be forced to, because the more and more patients that are asking these questions and then going somewhere else if they're not satisfied, at some point the dentist is gonna be like, okay, I'm losing a lot of patients here. Like, what am I doing wrong? So then they'll change.
But are they now? See, I think this is one of the problems with our new expanded insurance. Because a dentist is going to have access to innumerable patients.
Yeah, sure.
And
Yeah.
they'll be like, okay, well.
That's good. That's good. Then you have market stratification. So then you have people who want McDonald's, and then you have people who want, the keg, and then you have people who want, the better steak. Like it's good. The people who want cheap dentistry, who don't want to pay anything, they're gonna have a place to go. and people who care about their health more, with their health as a priority, they're gonna find the dentist that aligns with them. So
Well, yeah, but that's with all people, and some people will make the sacrifice for higher quality, nutritious food or
exactly,
care and what have you.
yeah. It's just a matter of priorities, right?
Yes.
So, I mean, there's millionaires who are like patients of our practice, not before we were the biological practice. We have patients who are millionaires that come in and say, I don't want to spend 1 cent over my insurance. And you're like, okay, like, if that's what your value system is, it's fine. I'm not going to try to change your mind.
There's a difference between being cheap and being frugal and spending when necessary.
Yeah.
It's like saying I don't want to spend more than 1 penny more than I need to on my roof.
Yeah.
Calm down. Are you investing in something of quality, or what are you doing here?
Yeah. All right, Susan, I think your hand is still up. Do you have another question? Yeah. Well, what an ounce of prevention is better than a pound of cure, or is worth a pound of cure. That's the saying, right? And that's the goal with getting information like this out, and especially when people have kids and trying to help the jaws develop and everything. It's like, you don't want to have to get your wisdom teeth out, or you don't want braces, you don't want any of this stuff. So the presentation I'm giving is at the end of the line. It's after the damage has been done, and it's what can we do to help fix and remediate it, to help people who are struggling with their health. But the whole reason that a lot of these patients are having health problems are because of the interventions that have been done, and in a lot of cases, the dental interventions that have been done. So yeah, you don't want any of this stuff if you don't need to have it. You don't want to get cavities. Like the best way to prevent having all these big dental issues is don't get a cavity. All right. Is there anything else? Anyone? I think we've gone an hour 40 minutes. I think that's pretty good. Let's just talk about the next one. So I think I want to stick to the first Monday of the month for now. I think, maybe when we get to January, that might need to switch. But for now, I'm looking at November. And the first Monday of November is the 3rd. Does that work for everybody? Does it? I could do the 10th too if that's preferable, and I'll just give preference to the people who are on the call tonight. The 3rd is good, Susan says. Shane, what about you?
I'm happy. I'll make the time.
So the 3rd you like?
Eddie, yeah, the 3rd's fine, or the 10th.
G, what about you?
I hope to be in Canada by then.
Chanel, I don't know if you've got your microphone.
Yeah, so the third is fine.
Yeah, okay. Okay,
Yeah.
so we'll set it for Monday, November 3rd, same time, 7 p.m. Eastern. I don't know if, just pay attention. If you're in a different time zone, Sometimes the daylight savings times are a little bit different. Like it can be a couple weeks apart or something. So just make sure you look up like what's the time in Toronto. So I will. Can you guys write me your emails? Chanel and Shane, you left yours. Susan and G, can you guys write your emails in the chat?
How do you get to the chat? Like, I'm not sure how to write it in the chat.
At the bottom right, there's an icon that says chat with everyone.
I'm only seeing like a microphone, a smiley face.
That's in the middle.
That's in the middle.
Like, are you on a computer or a phone?
I'm on the iPad.
iPad. So do you see one that says people? Like there's an icon that says people.
On the top right hand, it has like everybody's name on it.
Is there a thing that says six? Says 6 people?
Okay, I think I see it. Hold on. Yeah, I saw it. I got it.
You saw the chat?
Yeah, I got it. Yeah.
Okay. So yeah, G, just write your email there. Why don't I stop the recording?